Mother's decision to have her firstborn child at home comes with devastating consequences.
I was screaming from my bedroom for 5 minutes to take me to the hospital.
She believes she made a mistake having her child born at home.
It's a mistake she wants other families to avoid. It's why she's sharing her story with KATU investigator Anna Canzano.
When Margarita Shake got pregnant, she started seeing an obstetrician and was immediately turned off by those first appointments.
The appointments were really rushed. They were like 5 to 10 minutes, and I just started to get sort of uneasy.
With her husband stuck in India because of problems with his visa, this college-educated woman eventually settled on the idea of having her baby at home with the help of 2 midwives.
Everything that they had told me, I thought that I was in good hands. I didn't think that they were going to fail me at all.
She knew they were unlicensed and couldn't find data to confirm their history of delivering babies, but wound up taking them at their word.
I think that if the statistics had been out there, or if more people or more women were like confident in coming forth and telling their stories about what happened, that I probably wouldn't have decided to do a home birth.
Margarita went into labor 9 days after her due date and began an ordeal that's nearly inconceivable.
You were in labor for 8 days?
Yes.
Shahzad Shakil's birth date and death date are the same. He lived mere minutes. Her firstborn child, gone.
What do you regret, Margarita?
I don't regret trying to do a home birth, because in my head I was trying to do the best for my son. I really did think that that was the best way to bring him into this world. I just regret not asking for help outside of the midwives.
This is a life and death matter for children and for mothers.
Stories like Margarita's have Representative Mitch Greenlick renewing his effort to require that midwives be licensed. Oregon is just one of 2 states left in the country that don't regulate this profession.
I think we ought to make sure that just as when we're dealing with chiropractors or naturopaths or physicians or acupuncturists, we're making sure that the people who are practicing this health profession are doing it to the highest standards they possibly can. And if they're not licensed, we don't know what they're doing.
To get a midwifery license, you have to pass an exam with the National American Registry of Midwives. You must also have clinical experience as a primary birth attendant in at least 25 deliveries. You need to be certified in CPR, and you need to have a written transport plan in case of an emergency if either the mother or the newborn wind up in trouble. Of the 50,000 some births in Oregon every year, only about 1,000 are planned at-home deliveries, and the vast majority are conducted by midwives who are licensed.
The current program of voluntary licensure is working.
Silka Akerson's with the Oregon Midwifery Council. She says the council is neither for nor opposed to mandatory licensing, but needs better statistics about births at home versus hospitals before it even begins that conversation.
We feel to really know whether there is a problem, and then to discuss if there is a problem, what solutions there would be. The problem, we really need to be starting from accurate numbers.
Better numbers and mandatory licensing, measures Margarita Shake believes can help other families avoid her same heartbreaking mistake.
How many more babies have to die? You know, how many more preventable deaths is it going to take?
Anna Canzano, KATU News.
Now, Margarita also faults herself for not calling 911 while she was in labor, but she says she was exhausted mentally and felt cut off from her friends who tried to intervene. To learn more about the different kinds of midwives in Oregon, head to the Inside KATU section of KATU.com and look for the hot links.
It is already a pocket GPS calculator.